The next talk will be fuel your cardio journey. And to present this on walking, running, and beyond, to present this talk, we have Dr. Vinod Nathaniel. And Dr. Vinod Nathaniel, he is an ophthalmologist by profession and a certified fitness trainer from ISSA. And he's a for us, I think he's like a fitness freak. Yeah, his biggest run within 24 hours was 170 kilometers, and longest distance run in 2 consecutive days was 187 kilometer. So he's a finisher of full triathlon distance, and he's a running and fitness coach at Get Fit with Nats.com. So over to you, Vinod, sir. I'm stopping my screen. Yeah.
Thank you, sir. Thank you for the introduction and a very comprehensive talk from Dr. Ibrahim. Covered quite a lot of topics in one session. So I'll try to share my presentation again. Is it visible, sir?
Visible, sir, but it is a little bit on. Sir, are you sharing from the mobile, sir? It is a
mobile.
size. Or can you just rotate the orientation, sir? It is looking very small. Or shall I share it from my side, sir?
Yes. Okay. That'll be better.
Yeah. Yes, sir. Please tell next so that I can move the slide, sir. Yeah.
Okay. So today's topic is walking and running for beginners. Next slide, sir. So before we begin, I'd like to talk a little bit about myself. I'm 40 years old. I've started running from 2012. And before that, I was an athlete. To be more concise, I was a swimmer in my school days, and I continued to exercise through college and during my post graduation. So there was basically never any gap in between. So there was no radical transformation as such. So I just was consistent through, and I was able to maintain this. So before we talk about running, let us talk about something that is very basic. Some small changes that we can do in our regular lives before we start incorporating running, because running is something huge. Number சொன்னாவே எல்லாரும் பயந்துருவாங்க, ஐயோ ரன்னிங் ஆனால செய்ய முடியாது அப்படின்னு. So எடுத்த உடனே we don't need to think about running. So let us start with something basic that everybody else can start and use to burn calories. So first thing that we need to know is that we have to start taking more steps in our everyday lives. So நம்ம phone எல்லாத்துலயுமே we have, I think, Google Fit, or Samsung comes with Samsung Fit app. So all we have to do is take the phone wherever we go. Daily on the app, you'll see, you'll notice how many steps you've covered. So this is one thing I want everyone to try to do in their daily lives. So far, research has shown a normal office-going person usually comes to around only 4,000 steps. But for regular weight maintenance, you at least have to have around 8,000 steps. And for weight loss, it should be at least 10,000 steps and above. Especially in present scenario with so much of fast food everywhere. எங்க பார்த்தாலுமே we have food catering apps. எங்க பார்த்தாலுமே we have pastries, sweets. So இந்த பக்கம் திரும்பினாலே உடனே வந்து somebody will ask you to eat something that is high in sugar and cholesterol. So we need to put in the same amount of work. Other than நிச்சயமா will have will result in weight gain. So one is step count. We have to start increasing our step count. Maybe start with 4,000 steps and then work your way up. உடனே வந்து we don't need to elevate the number of steps that we do. The next thing is, this is something that all of us can do. We can incorporate exercise in everyday life. For example, instead of taking the elevator or the escalator lifted by the pillar, we can take the stairs. It's something that can be done in an everyday life. இப்போ பாத்தீங்கன்னா ஸ்கூல் காலேஜ்லயே வந்து பசங்க எல்லாருமே வந்து லிஃப்ட் எஸ்கலேட்டர் தான் யூஸ் பண்றாங்க. Very few people use the staircase. So because of this, there's a lot of obesity that is occurring even at a very young age. People don't like to do physical activity. So first step that I feel we should take is, before starting to actually exercise, we should incorporate more exercise into everyday life. For example, instead of taking the elevator, take the stairs. பக்கத்துல இருக்கிற கடைக்கு போறதுக்கு you don't need a bike or a car. You can walk 200 meters or 400 meters to nearby shop or to visit your friend. So in the மாதிரி சின்ன சின்ன விஷயங்கள் we have to change. This will also improve your step count and will also help you to burn more calories. The next one is healthy diet choices. Diet choices la paakumbodhu, you know, dietல வந்து we have a lot of fast foods every day. So fast foods எடுக்கிறதுக்கு பதிலா why can't we take the same calories in normal foods? That is the first thing. So for example, இப்போ 300 calories ஆப்பிள்ல சாப்பிடுறது வேற, அதே 300 calories 2 ஜிலேபி எடுத்து சாப்பிடுறது வேற. So apple வந்து probably one apple has around 100 calories, I think. Correct me if I'm wrong. So if you take 3 apples, you கிட்டத்தட்ட நம்ம ஸ்டமக் ஃபுல்லா இருக்கும். So 300 calories வரும். அதே இது 2 ஜிலேபி எடுத்தீங்கன்னா வரும். And most of the time, we won't stop with eating 2 jalebis. 2 jalebis சாப்பிட்டதுக்கு அப்புறம் we'll feel like we can have a tea, a cup of tea, or we'll go and have something like bhaji, whatever, bold or something like that. But if you choose something healthier, அதே 300 calories நீங்க ஆப்பிள் சாப்பிட்டீங்கன்னா, not only will you feel full, you will also get in lots of vitamins and minerals along with it. So healthy diet choices, அப்புறம் incorporating exercise in our daily life, அப்புறம் improving step count, இதெல்லாமே ரொம்ப ரொம்ப முக்கியம். Now let us come to walking. It is a good prerequisite for running, and try to aim for around 8,000 to 12,000 steps per day. Start with 4,000 steps. ஏன்னா எடுத்த உடனே எல்லாரும் 8,000 பண்ண முடியாது. அதனாலுமே வந்து I cannot do 8,000 on a working day. நான் இப்போ ஓடல அப்படின்னா ஒரு நார்மல் ஒர்க்கிங் டேல 4,000 ஸ்டெப்ஸ் மேல பண்றது கொஞ்சம் கஷ்டம். ஸோ ஸ்டார்ட் வித் 4,000 ஸ்டெப்ஸ் அண்ட் ஒர்க் யூ வே அவுட். வாக்கிங் பண்ணாவே வந்து உங்களுக்கு சைனோவியல் ஃப்ளூயிட் சர்க்குலேஷன் பெட்டர் ஆகும், ஜாயின்ஸ் வில் ஒர்க் பெட்டர், அண்ட் ஸ்லோலி ஓவர் டைம் your muscle strength will also improve. அதனால எடுத்த உடனே ஓடுறதுக்கு பதிலா start with walking, improve your synovial fluid circulation, and reduce your joint stiffness. And for your general information, 1,000 to 1,200 steps equals 1 kilometer. So if you've covered around 10,000 steps, congratulations, you've covered around 8.5 to 10 kilometers. And walking all the floors twice at Phoenix Mall will equal 12,000 steps. It's a personal recording. So if you walk all the floors in Phoenix Mall, எல்லாமே சேர்த்து 2 தடவை நாமினீங்க அப்படின்னா it comes to around 12,000 steps. That is around 10 to 12 kilometers. And 80 kg male burns 2,400 calories just by walking 16 hours of 13,000 steps. அதனால வாக்கிங்னாலே வந்து யாரும் கேட்டிருந்தீங்க the previous presentation. Definitely walking can be used as an exercise. You just have to do it over a longer amount of time. So the advantage of running is that you can burn more calories within a short amount of time. Whereas walking can burn the same amount of calories, but it will definitely take you longer. This is the main difference between walking and running. Walking is very suitable before you take the next step into running. Next slide, please. So these are a few studies linking diabetes to step count. So in the 2022 study, it was published in International Journal of Behavioral Nutrition. And here, higher daily step counts were associated with the lower risk of developing diabetes. The study also suggests that steps taken at a brisker pace might offer greater benefits for blood sugar control. So Dr. Ibrahim Somamari, concentrate a little on brisk walking. உங்களுக்கு நார்மல் வாக்கிங் செட் ஆயிடுச்சு அப்படின்னா ட்ரை டு டூ சம் பிரிஸ்க் வாக்கிங். எடுத்த உடனே ஃபுல்லா 1 kilometer பிரிஸ்க் வாக்கிங் பண்ணணும்னு அவசியம் இல்லை. ட்ரை லைக் 1 minute of brisk walking, 3 minutes of slow walking, again 1 minute of brisk walking. அதே மாதிரி தான் இப்போ ஜாகிங் ஈஸியா இருக்கு, ரன்னிங் கஷ்டமா இருக்கு அப்படின்னு நினைச்சீங்கன்னா ட்ரை 1 minute of jogging and 3 minutes of walking. அந்த மாதிரி கூட you can do. So this study suggests steps taken at a brisker pace helps you to lose weight fast and also reduce diabetes. Next slide. There was another study. This one was in 2017, published in PMC. This explored the effects of increased walking on blood sugar control in overweight individuals. So this study showed that participants who increased their daily steps significantly reduced their blood sugar levels. So this is another article linking higher number of steps per day to efficient blood sugar control. So I think we should all start telling our patients to take more steps, and all of them should install Google Fit or some kind of app on their phone, which will help them to improve the step count. Another advantage of doing this is that even overweight people can easily take more steps. ஆனா அவங்க ஓட சொன்னா definitely cause problems. Overweight people should not be running. So let them start with walking and increasing step count, and as they lose weight, கொஞ்சமா we can encourage them to other activities like cycling and running. Next slide. And this is another study in 2020. This was published in BMC Public Health, investigated the link between daily steps and diabetes in older adults. In the study, 70 year olds பண்ணிருக்கு. So 70-year-old people panna study la at least 4,500 steps per day led to a significantly lower risk of developing diabetes. இவங்களுக்கு ஏற்கனவே diabetes வரல. So this 4,500 steps at the age of 70 help them to reduce the incidence of diabetes. அதனால அந்த ஏஜ்லயே அவங்க 4,500 steps நடக்கிறாங்கன்னா probably at around 40 years of age நான் சொன்ன மாதிரி at least 8,000 10,000 steps நம்ம கவர் பண்ணாதான் அந்த ஏஜ்ல நமக்கு அந்த ஹெல்த் மெயின்டைன் பண்ண முடியும். So let us start taking more step count from today. Start with 4,000 and start increasing your step count every month. Like for 4,000 பண்றீங்கன்னா next month, next 2 weeksல 4,500, அடுத்த 2 weeksல 5,000 steps. இந்த மாதிரி டெய்லி கொஞ்சம் கொஞ்சமா இன்க்ரீஸ் பண்ணிட்டு வந்தீங்கன்னா it will be good. By the end of the year, you should be covering 10,000 steps. Next slide. And stretching. Stretching is very important. And that's why yoga or mobility work should be following walks or any kind of workout, running on normal side. So any kind of aerobic activity should be followed by yoga or static stretching. Static stretching, you have static stretching and dynamic stretching. Dynamic stretching, your movements will be fast. So for example, side to side twist, fast up on the mode, it is a dynamic stretch. But if you twist to one side and hold, then it becomes a static stretch. In the same way, if you hold your elbow like this for 20 to 40 seconds, this is the static stretch. So every static stretches, should be done after the workout. And dynamic stretches, which is mainly to increase the temperature in your joints or warm up your joints before the activity, it should be done before the workout. Dynamic after workout, but static workout should always be done after the workout. So 3 mobility days per week. Mobility and you can keep it for stretching. So 3 mobility days per week, and each mobility session should be at least 20 to 25 minutes. So நிறைய பேர் இந்த சும்மா ஏமாதான் ஒரு 5-10 minutes சும்மா stretching பண்ணுவாங்க per day. That might not be enough if your activity is very hard. That's one of the main reasons why people develop a lot of joint issues or knee pain after running. You should do a proper stretching routine at least 20 to 25 minutes after your work. Next slide, sir. So coming to strength training, my colleague Naveen will also be covering a little bit on this. And strength training for runners and Pagamudu, this is a little more specific. So strength training for runners and Pagamudu, leg strength, leg strength, and also your glutes. So these are very important. So before you start running, increase your step count. Adale leg strength and glute strength. Other you can try some exercises at gym, such as leg press, and you can try, or dumbbell squats. Lunges, it will work your glute muscles. So more details on these exercises will follow in the next presentation. Core strength is also very important. So core, most of us will think of the 6 packs. So other than the rectus abdominis, there are many other muscles that form the core in the body. These include the external obliques, transversus abdominis, multifidus, rectus spinae, diaphragm, which helps in breathing, and pelvic floor muscles. So all of these together form the body's core muscles. So all these muscles have to be strengthened, but this happens with time. It doesn't happen in one shot. And that is why running should never be taken up suddenly. இப்போ யோசிச்சு பாத்தீங்கன்னா லாஸ்ட் டைம் தட் வி ரன் ப்ராபப்லி நம்ம ஸ்கூல்ல ஓடி இருப்போம், காலேஜ்ல ஏதாவது ஒரு ஸ்போர்ட்ஸ் ஃபங்க்ஷன் வந்துருந்துச்சுன்னா அதுக்கு நம்ம ப்ரிப்பேர் பண்ணிருப்போம். அதுக்கப்புறம் திடீர்னு இஃப் யூ கோயிங் டு ரன், obviously you need to strengthen your body a bit. You have to practice proper stretching, and you also have to increase the synovial fluid circulation, reduce joint stiffness by increasing your step count. இதெல்லாம் செஞ்சதுக்கு அப்புறம் தான் நீங்க மெதுவா ரன்னிங்க்கு வரணும். And if you are overweight or obese, it's better that you lose a little weight first before you go. Next slide, sir. So next thing, if you are going to take up running seriously, please start taking photos. So this is very underrated, but this should be done, especially if you're thinking of running. So எப்பயுமே ஒரு anatomical deformity இருந்துச்சுன்னா அதை வச்சுட்டு ஓடுறது it's going to be difficult because there will be more load on one side. So if you have a hip tilt can be either lateral or anterior posterior. So there are 3 types. So if you have a hip tilt, try to correct it with your physiotherapist or strengthen the muscles on the opposite side so that you can run safely. Running is a very repetitive motion. So நான் சொன்ன மாதிரி ஒரு கிலோமீட்டர்ல you have to take around 1,000 steps. So if you run 1,000 steps incorrectly, your body will definitely end up with issues. So always correct your posture before you start running. And before correcting your posture, start walking, increasing your step count. Also look for slouched posture. So you have to correct that with appropriate exercises. before you start serious running. And also any kind of shoulder imbalance should also be corrected, because shoulder one side on the side that you'll be putting more weight on your knee and your ankle. So all the joints will be affected. So always correct your posture first before you take up serious running. Next slide, sir. Okay, so now that we've established what are to do before, let us get into the actual concept of how to start running. First is transitioning from walking to jogging. So 10,000 steps you daily cover then you can start running. So start with 30 steps of jogging. 30 steps jogging பண்ணிட்டு then you go for 100 steps of walk. So alternate between these two for at least 30 minutes twice a week. வாரத்துல 2 நாள் மட்டும் 30 steps jogging, alternate with 100 steps walking. Then progress to 50 steps jogging and alternated with 100 இதுவும் அதே மாதிரி 30 minutes. 1 or 2 months இந்த மாதிரி செய்யுங்க 50 steps and alternation. After that, move on to the same thing for 3 days a week. And on the 30 minutes, make it 40 minutes for each session. At the also make it 4 days a week for 40 minutes. In the 5th month, what we are going to reduce the 100 steps of walking to 80 steps. We are going to do 50 steps of jogging and 80 steps of walking 4 days a week. And the 6th month, we are going to do 50 steps of jogging with 50 steps walking 4 days a week. So again, we are reducing the walking steps. 7th month, we are going to increase the jogging steps 50 to 70. And again, we are going to reduce the walking steps from 50 to 30. So 70-30 ratio, 7th month, say. Usually around the 6th or 7th month, they may get knee pain or shin pain. In the money, just back off for 3 days and re-attempt. அப்படியும் சரியாகல அப்படின்னா திருப்பி நீங்க day 1 எப்படி செஞ்சீங்க அந்த 30 steps walk, 30 steps jog and 100 steps walk கொஞ்ச நாள் பண்ணிட்டு come back and tries. So don't immediately give up. And another problem is pain இருந்தாலுமே some people push through pain. Please don't push through pain. Discomfort is okay, but pain is not okay. Whenever you have pain, please stop, take Tnsb, relax. The rise therapy, rise பண்ணிட்டு and after that and try to resume the activity. Next slide, sir. So in the 8th month, you can do 80 steps of jogging with 20 steps walk, 45 minutes sessions, and this should be done 5 times a week. In the 9th month, we have to do 5 days a week of the following. First 2 weeks, you have to do 100 steps jog and 20 steps walk. For walk on the 100 steps and 20 steps on the step. In the second 2 weeks, you do 120 steps of jogging with 20 steps of walking and keep alternating. And 10th month, again 5 days a week. First 2 weeks, do 160 steps jog. So this is a big jump, 120 and 160 jump on row, because once you cross 100, you will have enough muscle strength to transition into more running. So now we are going to transition to 160 and then alternate with 20 steps of walking. In the second 2 weeks, we're going to do 200 steps of jogging and 20 steps walking. Again, if you have any sort of pain or discomfort, back off for a while, then try to come back and do. When you're backing off, you can try other sports like cycling, swimming, weight training. You can also try some intermittent fasting or some kind of calorie restriction so that you will lose a little weight. In a weight, if you try to come back to running, most of the time the pain will disappear. And on the 11th month, you do 3 times a week of 250 steps jogging with 45 minutes and walk 45 minutes thrice a week. So only 3 times a week will be running and the remaining 3 days will be walking, because we're radically increasing the steps, running steps. 1 year, you'll be doing 300 steps of jogging with 20 steps walking, or 250 steps jog and 20 steps walk. So this will, the first one will be done twice a week and the next one will be done thrice a week. So you'll be doing 5 days of running per week. Next slide. So let's talk a little bit about run form. So now core muscles participation. So core should be engaged. So even when you do any kind of activity at home, you use to a cupboard open or heavy table open, our abs will automatically be engaged. It will be tight. So we don't need to consciously do it. And running, we never do it It never happens automatically because we don't run at all. Our body has lost that formula. So what we should do is we should consciously engage our abdomen and our glutes. So the ரெண்டுமே வந்து engage பண்ணணும். Core and glutes should be engaged, and it should be tight. It should be ready to run. Should be ready to absorb impact. அடுத்தது வந்து heel flicks. So most common mistake is lifting the knee and banging it down. So instead of that, try to bring your heel 2 centimeters above the ground. பின்னாடி. So heel flicks should be done, and it should not be too high. Just a few centimeters above the ground is enough. Elbows should go behind when you're running. Elbow box backward. Phone போட்டு ஓடக்கூடாது. No slouching. Engage the glutes. And another common mistake I see is people take very big steps. They keep one foot forward like this, another foot like this. So instead of doing that, just put half a foot in front of the other foot, like this. Very miniature steps. So in this, when you run like this, there is hardly any chance of injury. So when you run with such a big gap in between, you will most probably exerting a force that is around 8 to 10 times your body weight on the ground, and there is more chance of injury. But when you take mini steps and you try to take more steps every second in the form of mini steps, it is very easy to run with very less chance of injury. So only half foot forward and land beneath the center of gravity. So this is also very important, not out and front. Aim for 160 to 200 cadence. So cadence is the number of steps per minute. So if you're taking only 120 steps per minute or only 150 steps per minute, there is more chance of injury because your steps will be big. There'll be more joint force and impact. So obviously, there's more chance for injury. But when you're taking many steps and running very small steps, there is very less chance for injury. So aim for 3 steps every second so that you will have a cadence of around 180. Next thing is make sure the upper body is partially involved. So ஓடும்போது ரோபோட் மாதிரி ஓடுறது பதிலா just focusing on legs is not going to be enough. You also have to move your elbows and make sure when you're running, connect your upper body with your lower body when you. So because everything is interconnected. So upper body involved பண்ணி ஓடுனீங்கன்னா the chances of injury are very less. Next slide. When to stop running. So there are relative indications and also absolute indications. The relative indications are any kind of joint discomfort. It could be knee or hip discomfort, heel or ankle discomfort, and general fatigue. Why general fatigue? Because in general fatigue, we covered so many points on the previous slide. So when you are tired, you won't remember. So as I said before, running is like driving a car. You have to remember several things at the same time. So this comes only with practice. The practice says, as you get used to it, you can do everything simultaneously. But as a beginner, if you try to run when you're tired, you'll make a lot of mistakes. You will overstrain, you will cause more joint impact. And because of that, you will have to stop running early. So when you're very tired, it's better not to run. Absolute indications, of course, all of you know, fever, any kind of giddiness, dizziness, palpitations, shortness of breath, any kind of pain anywhere, any joint pain, or even very sharp shin pain. All these are very strong indications to not run. And of course, less than 4 hours sleep, because we are seeing many deaths these days. And people who work out should be very aware that they should not be working out when they have very less sleep. So any day when you're sleeping very less, please don't work out or run or do any kind of intense exercise. Please resort only to walking. So when you're sleeping more than 6 hours per day, then you can try to run or work out. Next slide. So staying safe. So again, when you are running, you have to pay attention to your heart and your heart rate. So it's better to invest in a gadget. The thing is, if you are a beginner and you're not sure how long you're going to run, then I'd suggest that you invest in something like a normal gadget like an Amazfit. எடுத்த உடனே government வாங்கணும்னு அவசியம் இல்லை. So an Amazfit watch costs anywhere between 4,000 or 5,000 to around 13,000, depending on the model. So these watches will have different modes like running, walking, cycling, இந்த மாதிரி cardio, இந்த மாதிரி நிறைய modes இருக்கு, and it will help you to monitor your heart rate. So make sure your heart rate doesn't cross 120 to 140 during easy jogging. And as sir said before, according to age, the workout heart rate will vary. So usually the average heart rate below 40 years of age should not cross 150. And between 40 to 50, it should be around 130, 120 to 130, something like that. So as you grow older, the heart rate that you're working out in should reduce and stay in the same zone for 70 to 80% of your runs every day. So 70 to 80% of your runs should be easy runs, walking or jogging. And the remaining 20% can be done in the form of faster jogging or sprints according to your preference. Next slide, sir. Thank you. So this, what I wanted to mainly stress was running is definitely advisable for everyone in the present scenario because of all the fast food that we're consuming and the reduced activity that we're doing. The advantage of running is that we are going to burn more calories in a shorter amount of time, and it is suited for a busy lifestyle. That is why I think everybody should take up running at some point of time. And the advantage of slow jogging is also very important because it improves your heart health also at the same time. It's not just about burning calories; it's also about how you feel and the amount of endorphins that you feel. So if you feel that at any point you're suffering too much, it's probably because you're running too fast. Make it an enjoyable activity. That is the main point that I'd like to stress. If running is not enjoyable, you must be doing it too fast for yourself. So try to do it at a pace which you can maintain for the rest of your life. So that's what I wanted to tell. Thanks a lot for the opportunity. Thank you.
Thank you, sir. That was a wonderful talk. And so running has always been an elusive matter for us. நான் கூட ஒரு லாஸ்ட் இயர் ஈரோடு மேரத்தான் கூட ட்ரை பண்ணி ஒரே வாரத்தில் நீங்கள் சொன்ன எல்லா மிஸ்டேக்கையும் பண்ணி கால் இன்ஜுரி ஆச்சு. So after listening to your talk, now I understand that how important it is to concentrate on all these things, sir. Duraikannan, sir, your insights, please, sir, about his excellent talk.
Thank you, Vinod. They have done an excellent lecture on the running,
Thank you.
walking, jogging, everything. Make it very simple, first thing.
Thank you.
Your step counting, 4,000 in the office, 8,000 when you walk. For weight reduction, at least 10,000 steps you should do it. It's very, very, very easy way to follow the people like us. And using lift. Another thing, we better avoid using lift. That would be best exercise when you climb up. Apple is fatty as well as calories enough, and we have to do some steps up to 1,200 steps a day. It is an excellent formula for everyone. Diabetic excellently told that every step of running, walking, reduce your risk. This should be a mantra for all people. Higher step, higher blood sugar is reduced. Stretching, yoga and stretching exercise and dynamic exercise are very, very important, and mobility also to increase. The strengthening exercise always focusing on where to strengthen, when to strengthen, and what are the muscles to be strengthened. All 6-7 muscles have to be strengthened, all in the abdomen as well as near your other area. And jogging, 1,000 steps is 10,000 steps only jogging. The goal, slowly raising up your jogging is very good formula, where start with the 30 steps of jogging to 1,000 steps of jogging. Running, all people run, we know running, but we don't know how to run. You make it very easy how to run, what to run. We people are in the younger age, we run for our trophies, but we do not know the physiology of running. You make it very clear for everyone who can understand what is running, jogging, better than taking care of your heart. Thank you. Excellently you have explained, sir. Keep it up. It's very knowledgeable, very important knowledge to all the people. Thank you. Thank you very much.
Thank you, sir, for your valuable comments. So I have multiple questions for you, Vinod, sir. So the first question, time or distance target, which is better for running training?
Right, sir. So both are excellent variables, sir. So in any exercise, sir, when you are aiming for progression, you can either aim gym workout போடுறோம்னா we can increase the weight or we can increase the number of sets. அதே மாதிரி தான் in running you can either increase the amount of time or you can increase the amount of distance. So whichever is more comfortable, we can do. So for some people, first if they are running 3 kilometers every day for 1 week, we can ask them to run 3.2 kilometers every day for the next month. So அந்த மாதிரி per month வந்து ஒரு 200 meters ஏற்றணும் அப்படியே போகும். So most of the time, mistake I see everybody making is they'll increase in terms of 3 kilometers or 4 kilometers. So அந்த மாதிரி திடீர்னு ஒரு பெரிய ப்ராக்ரஸ் கொண்டு வரும்போது they'll get injured. So every month, maybe daily 200 meters increase should be.
Thank you, sir. Cycling as an exercise, your word, please.
Yes, sir, definitely. As I said, cycling is also a very good exercise. It's a good form of cross training also. And according to what I've experienced, I can say that cycling burns around 1/3 calories lesser than running. So for if you have any kind of joint issues, you're not able to run. Now, even if you fall and you're still getting pain while running, definitely cycling would be a very good option. And also, if you're obese and you cannot start running immediately, cycling is good. The only problem with cycling is that you may get knee pain when you're going uphill. So when you're climbing a flyover or a bridge on the and you'll have a lot of issues with knee pain. But static cycling, if you're going to do it inside the house, it's good.
Okay, sir. For a 50-year-old person, yes, sir. Sir.
What about using the walking at home?
Yes, sir.
Using any machinery. Walkers.
Yes, sir. Correct, sir. Walking பண்ணலாம், as I said, on the 10,000 steps per day.
The walkerல போகும்போது knee pain வரும்னு சொல்றாங்க. Walker, how the walker should be used?
Which walker? The elliptical சொல்றீங்களா sir?
Elliptical.
On the stair
Both are there, but we want to know which we can use.
You can use elliptical, sir. Elliptical will have a lesser effect on your joints. It will be almost equal to whatever calories are burning in cycling.
So can a person with previous partial cruciate ligament and patellar retinaculum partial tear or any like injuries like this, can they jog or run? And if so, what
yes,
protection is there?
Yes, sir. After they are well healed, then they can start running. If there is no inflammation, there are many people who have had ligament injuries in the knee, and after proper rehab for 6 to 8 months or 1 year, they've come back into running. There's contraindication only in the initial acute stage, but after good rehab and muscle training, they can come back. The only thing is here, we have to be very consistent and we have to visit the physiotherapist regularly.
What is the age limit for running, sir?
No age limits. Actually, okay, I know so many, hello, Navi. So many people are there, including my own friends. We have a 70-year-old here in Trichy. He runs 20 kilometers every day. So there are so many people who can run. The only thing is, as I said, start walking, increase synovial circulation, do a lot of stretching before you get into running.
Thank you, sir. So does putting inclination in treadmill, will it increase calorie loss? Is it better than normal walking or
definitely? Yes. So if you're feeling bored and if you want to do more activity in lesser amount of time, if you're afraid of running, definitely incline walking also will be very helpful.
Okay, sir. And morning or evening time, which is preferable for running or walking?
Anything is fine, sir. Anything is fine. Whatever suits you. I've done both. Advantage na solra. Morning time la you feel little fresh to do, but only downside with morning is that you will need more warm up. So and evening time la pathina you can run very easily, but you will be tired at the end of the day. So whichever is suitable for you, you can take.
So after 50 years, final question. After 50 years, how to increase the number of steps gradually after 5,000 steps, or like you have given some guidelines, we should we slow down or as per their individual capacity?
As per their capacity. So usually I advise increasing 500 steps every 2 weeks.
Okay, sir. Any difference between treadmill and ground walking?
Depends on the treadmill, sir. Usually any treadmill less than 1 lakh usually doesn't have much cushioning. So you have to be very careful when you purchase if you are overweight. So if your BMI is good, then even 40,000 treadmill will work well for you. But for overweight individuals, they should be very careful in what kind of treadmill they buy. Or they can just visit a good gym Gym, the commercial treadmill will have a lot of cushioning. So gym treadmills are usually safer than home treadmills.
Okay, sir. Like, and after 50 or 60 years, can they do ellipticals and workout? Is it okay, sir?
Definitely. Proper.
Okay. Okay, sir. Thanks for patient answering, sir. That was a wonderful session.